Are you on cyclobenzaprine and concerned about the side effects? Or is your back killing you and you were just given this medication and you're not sure whether you should take it? Well, if so, then keep watching because we're going to answer the most common questions that you may have about this medication. As well, stay to the end because we're going to give you 4 tips on what you can do to get your back pain under control. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. In today's video, we're going to be going over the most common muscle relaxant that is given called cyclobenzaprine or Flexeril. Cyclobenzaprine is a medication that we use on a short-term basis to treat muscle spasms, most often in the back or neck. It works on the brain to interrupt signals that lead to excessive spasms in the muscles. It's best used for short-term treatment of injuries involving the muscles and muscle spasms. Cyclobenzaprine comes in tablets of 5, 7.5, and 10 milligrams. It can be taken up to 3 times a day, and an extended release version of 15 and 30 milligrams that is taken daily. There are some very real side effects that you can get with this medication. The most common that we see is drowsiness, dry mouth, and dizziness. These can range from mild to more significant. Now, probably out of all the side effects, drowsiness seems to be the most common. This isn't necessarily a bad thing at night, but it can be hard to take during the day if you need to be up doing anything. And the higher the dose, the more significant those symptoms tend to be. Now, other symptoms can be some fatigue, constipation, nausea, blurry vision, and nervousness. Since we're taking this to help for pain, and most people are more concerned about that, smaller, more mild side effects tend not to be noticed as much. Rarely conditions such as seizures, some heart rhythm problems, stroke, heart attack, and allergic reaction can happen. These certainly aren't common, so unless you have some underlying conditions that may put you at risk for these, I wouldn't let this be a reason not to take it. Patients who suffer from severe liver disease, overactive thyroid, heart problems that include irregular heartbeats, heart failure, or a recent heart attack, those who suffer from difficulty urinating due to a large prostate, and those with eye problems such as glaucoma should be very careful or avoid taking this medication. Also, those over the age of 65 should be extra careful because you're at higher risk of having complications from cyclobenzaprine. It also has some interactions with certain medications, so reviewing your medications with your doctor and pharmacist is important. Because of its sedating nature, you should avoid taking it or be careful while taking other sedating substances like narcotics, benzodiazepines, sleeping medications, alcohol, and marijuana, which can make the effects worse. As well, definitely avoid driving and other dangerous activities while you're taking it. So those are the main questions that come up when taking this medication. It can be a real help in getting you through that back injury. But the biggest question you probably have, though, is related to the reason that you're taking it. And that is, what can you do to get rid of your pain? So here are 4 simple bonus steps that you can do to help you if you just recently started having back and neck pain. The first is, as much as possible, stay moving. One of the tendencies that we have with back pain is to lay down. Sometimes you have to, but as much as possible, you still need to move. Staying still makes things worse and can make your recovery take longer. You don't want to do things that make your pain worse, but if you're resting, set a timer to get up every 20 minutes and walk and gently stretch. The next is ice and heat. If you just injured your back, using ice on the area can help decrease inflammation. After a few days, applying heat in the form of a warm bath, hot water bottle, heating pad, or a hot tub can help relax muscles and improve blood flow. Now this can go far in helping that muscle spasm start to calm down. Hint number 3 is start taking over-the-counter pain medications right at the onset of symptoms. If you're otherwise healthy and not taking a lot of medications, alternating anti-inflammatory medications like ibuprofen or naproxen with medications like acetaminophen can do well to decrease swelling and improve pain. Hint 4 is don't be afraid to incorporate other treatment options like massage, acupuncture, and spinal manipulation, all of which can be great options in providing relief. It's important to remember that most acute back pain gets better on its own within 3 to 4 weeks, so being patient with it and incorporating the various treatment options can really help. There are some symptoms, though, that should prompt you to seek care right away. If you have any numbness or tingling around your groin or buttock, difficulty urinating, loss of bladder or bowel control, fever, unexplained weight loss, swelling or deformity in your back, or if you've had a significant injury or accident, or if it just isn't getting any better, you need to get into your doctor right away. So that's the rundown on cyclobenzaprine, as well as a few bonus pointers on how you can get some relief to that back pain that you have. I really hope that you found it helpful. If you did, make sure you give this video a like and share it with your friends. It does help our channel to grow and reach others that may need this in their life. And don't leave without subscribing and hitting that notification button so you don't miss out on any of our future content. Well, it really has been a pleasure sharing these few moments with you. We just want to wish you good luck in your health journey, and we'll see you in the next video.